Hi, my name's Lee Aase. I'm the founder of HELPcare, and this video is all about solving metabolic syndrome. In the last generation, we've seen the rates of obesity in the United States go up dramatically. In 1990, there was no state with an obesity rate of more than 15%. Just 28 years later, there's no state with an obesity rate of less than 20%. Obesity has tripled nationally in a generation. And it's really just a symptom of a failing system. A parallel and related problem is the increase in the diabetes diagnoses. In 1958, less than 1% of Americans had diabetes. By 2015, that number had risen to 7.4%, or over 23 million. So prevalence in less than 60 years increased by 800%. The unifying thread behind both of these trends is a syndrome called metabolic syndrome. Metabolic syndrome is related to problems in turning food into energy and how the body responds to different energy sources. Metabolic syndrome is formally diagnosed when you have any three of the 5 primary criteria that are true of you. The first is high blood sugar, having fasting blood glucose of more than 100 milligrams per deciliter. If you watched my first video, you may remember that my wife Lisa had a fasting glucose reading of 102, and that's part of what got us on this health journey. The second and third criteria come from the standard lipid panel, high triglycerides of more than 150, or low HDL cholesterol, that's the so-called good cholesterol. For men, having that be lower than 40, or for women, lower than 50 is an indicator of risk. The fourth criterion is high blood pressure, having more than 130 for systolic or more than 85 for diastolic. And then the last characteristic is obesity, having waist more than 40 inches for men or more than 35 inches for women. And in this case, we're talking the waist measurement at the natural waist around the belly button and not lower where your jeans might be riding. So if you have any 3 of these conditions, you formally have metabolic syndrome. But the bad news is that if you have even one of them, you're probably on the path, because having one of those makes it likely that the others are going to follow. So what does that mean if you have metabolic syndrome? Well, if you have metabolic syndrome, you're 5 to 11 times more likely to develop type 2 diabetes. You have twice the risk of developing cardiovascular disease and dying from it. More than 4 out of 10 cancers are related to overweight and obesity. And then you also have an increased risk of Alzheimer's or other forms of dementia. In fact, Alzheimer's disease is sometimes called type 3 diabetes. So altogether, these diseases add up to 70% or more of US healthcare dollars spent. And so they're not only costly in terms of dollars, though, but they're also among the most feared and deadly diseases. My good friend and high school classmate, Dr. David Strobel, is our medical director for HELPcare. He's had a long-term interest in metabolic syndrome as he has seen it become more and more important as the underlying cause of many of the diseases and conditions his patients have had. Together with Dr. Strobel, we've developed this mission, restoring the soul of healthcare. We want to help people save themselves from a system that's undermined their health and vitality so they can prevent and even reverse many diseases and conditions. We want to give people information and support that enables them to accomplish their healthcare goals. Dr. Strobel and I have written this booklet called HELP, the Health, Energy, and Longevity Plan. It's a 10-point plan you can apply on your own to improve your health and vitality. We hope you'll download it and use it to achieve your health improvement goals. If you want or need additional support in making health changes, we offer HELPcare Community. That's a safe, supportive online community that also includes learning modules in which Dr. Strobel goes into significant detail in describing metabolic syndrome and helping you to better understand how your body works, how your body processes energy, so that you can make the changes you need. If you'd like to try HELPcare Community, we offer a 1-month free trial, and then after that, it's $19 a month or $199 a year. The next level of help we offer is HELPcare Coach. This provides all the benefits of HELPcare Community, plus a coach who will work with you to develop a plan that works for you. It includes both cohort and one-on-one coaching sessions, and this will be $49 a month or $4.99 a year. In the final video of this series, I'll introduce you to HELPcare Clinic, where we aim to put restoring the soul of healthcare into full effect. We'll examine some of the problems with the U.S. healthcare system today, and then also talk about HELPcare Clinic and its direct primary care model, which can make healthcare more affordable, more personal, and more effective. Thanks for watching this video. I hope you'll share it with your family and friends and on your social media accounts.